Welcome back to our channel Community Medicine Made Easy. This video is regarding coronavirus. We all know coronavirus epidemic is rapidly spreading all throughout the world right now. But what we are going to deal today in our video is not regarding the worldwide panic, but regarding our community medicine examination. Because why I am taking this video, the main reason is the Nipah virus outbreak, which occurred in the year 2018. The same year, it was asked in your community medicine exam question paper. Similarly, this year there is a high chance that coronavirus could be asked in your undergraduate community medicine examination. So, just we will have a glimpse about what is coronavirus, what are the communicable diseases pattern, agent, host, environmental factors with respect to coronavirus, and then with respect to the key factors and how to prevent and control. This will be very useful for your upcoming examination. If you see the agent factors in coronavirus, it is the 2019 nCoV. It is the name of this virus. It is 80% morphologically similar to the SARS virus which occurred in the year 2003 in China. It is very similar to it. What is the source of infection? It is the clinical case of coronavirus infection. And what is the infectivity? The infectivity is 14 days before the onset of illness and thereafter it continues. So, who's the reservoir? So, actually, it is being said that the virus originated from the animal population, mainly from the animal market in Wuhan province of China. So, in this specific virus, it is the animal reservoir which has played a major role in the outbreak in China. It is being said that initially it was said that bats, but now it is being said that the snakes are responsible for the origin of the infection, and thereafter the cross infection between the human and animal population led to this infection, which continued among the human population. The secondary attack rate, as of based on the preliminary data, we don't know much, but it should be said to be very high. And that's all about the agent factors. What are the host factors? If you see the age and sex, it is mostly the adults, and both sexes are usually affected. And coming to the immunity, it is a cell-mediated immunity. Person who are having good cell-mediated immunity recover from the infection, but those who are having poor cell-mediated immunity, like in immunocompromised state, diabetes, elderly, and in children, the disease is said to be fatal sometimes. And what are the environmental factors? The environmental factor is very unpredictable in case of coronavirus, mainly because it occurs very rarely but suddenly because of the antigenic variation, because of the antigenic shift drift which can occur in the virus. The how it occurs, how the viral infection suddenly occurs, we don't know. So it is unpredictable, but definitely it is common during the winter season. Coming to the mode of transmission, it is mostly through the droplet infection and through the even through direct contact. And then what is the incubation period? The incubation period is 14 days. What are the key points with respect to coronavirus infection? If you see, the outbreak mainly started from China, the Wuhan's seafood market. On December 31, the first case was being reported. This virus is 80% morphologically similar to the SARS virus outbreak, which occurred in 2003. This was the reason for alarm among the people, and public were concerned. So more than 2000 cases have been identified so far, and 56 deaths have been reported until today. And the recent news is today, even in India, there were 2 cases of coronavirus which was identified. And what are the symptoms of coronavirus infection? It starts like any other upper respiratory infection: cough, muscle pain, and fatigue. And less common symptoms are headache, diarrhea, and bloody stools. What are the signs? If you say, it is mainly the pneumonia features, the lung abnormalities in CT scan with X-ray showing unilateral patchy infiltrate, which quickly progresses to bilateral infiltrates. The mortality rate based on preliminary investigations is said to be higher. And if you see, this is a table showing the mortality rate for different diseases, and we can see that the 2019 novel coronavirus has the secondary attack rate of 1.4 to 2.5 and a 4% mortality rate. And what is the prevention and control measures? This quarantine, if you see, China has now initiated a massive measure like the people are not allowed to go out of the Wuhan province, which is the epicenter of the epidemic. All the toll plazas were shut down, and air travel is cancelled. The airport is closed, the seaport is closed, and it is virtually a massive quarantine undertaken by a government, and it is a very effective measure to control the spread. And this is the same thing which happened in 2003, and China applied such drastic measures to prevent the spread. And second thing is isolation. Even wherever the cases are being found to be positive for coronavirus, they should be immediately isolated until the infection wanes and until the symptoms are totally disappeared. What is the other strategy? The ban on air travel and sea travel, shutting down the airport and seaport. And the most important strategy is active finding and intensive surveillance. This is the most important measure that should be applied here to control the prevent the spread of epidemic. China was very successful in 2003 because of this strategy only. It is active case finding and intensive surveillance. Whenever, wherever it is being cases are reported, immediately they should be isolated. So it is very important to control their spread within the geographical area so that doesn't spread to other geographical areas. And no vaccination is currently available for this coronavirus infection. And as usual for any viral infection, the personal protective measures are very important. Using the face mask, covering the nose and nostrils while sneezing, frequent hand washing, and monitoring the symptoms for the occurrence of symptoms similar to coronavirus. So these are the normal strategies which should be undertaken for as like any other viral infection. So suppose in your examination the coronavirus is asked as a essay question like how to control the outbreak of coronavirus infection, then you have to answer like following the steps of the investigation of the epidemic, which is given in your epidemiology chapter. Just apply those steps here and include the points which I have given you till now. Same agent host environmental model should be written, the clinical symptoms should be written, followed by the prevention and control, then followed by investigation of the epidemic, that is outbreak investigation. So follow these steps and don't forget to mention the key points which I gave with respect to coronavirus, the intensive case finding and surveillance and personal protective measures and isolation and quarantine. So all the best dear students for your upcoming examination. Next video is regarding medical sociology. So if you like our channel Community Medicine Made Easy, kindly subscribe our channel. If you like this video, put your likes below and comments below. Meet you all in next video, which is medical sociology. Until then, goodbye from Dr. Karthikeyan.